I'm walking in, we're gonna be in one of these rooms over here where you do your Foley check off, so there'll be a drawer.
Come in.
Hi, my name's Terry. I'm gonna be your nurse today. Give me just a second here to wash up.
Oh, I'm so glad you're washing your hands. So many people don't.
I know, sometimes that's true. They forget. You remind them. Can you give me your name and date of birth, please?
Nancy B. Month, day, year.
Okay, got that? My time is up. I'm here to do a partial physical exam, a head-to-toe exam on you as ordered. And so today I'm going to be asking you a few questions and everything. First, I'm going to look at this IV pole. I'm going to check my orders. I see that we have normal saline hanging at 50 mils an hour. And here's your IV side. Is it giving you, is it tender when I touch it?
Just a little.
Okay, well, I don't see any redness or swelling. We'll take a further look at that in just a little bit.
So do you mean I have to put my head to my toe?
No. So, do you have any allergies? May I call you Nancy?
Yes, you may.
Do you have any allergies?
No, ma'am.
Okay. Do you know where you are today? What building?
Yes. I'm on the 5th floor of University Hall.
Okay, do you know about what time of day it is?
Yes, it's probably 1:30 in the afternoon.
Okay, it is very close to that. I'd like to know, can you tell how many fingers I have up?
4.
So you could see my hand and you could hear my question. That's good. Could you give me a big smile? All right, your face looks symmetric on both sides. That's great. Do you, I would like for you to place your finger on one side of your nose and press and breathe in through the other side, please. Okay. Can you breathe in and out fine there and do it to the other side? Okay, so your airway passages are patent. Miss Nancy, do you have any pain today?
No, I do not.
I'm going to rephrase that and ask you on a scale of 0 to 10. Do you, with 10 being the worst pain you could experience and 0 of course being none, do you have any pain today?
No. 0.
0. All right, sounds good. You don't appear to be in any signs of distress or anything like that. I'm going to take a look. Oh, that's got a little thing on there. I hope that doesn't fall off of your mouth. Open it wide. I'm going to look inside, just side, up, and underneath your tongue. Mucous membranes are pink and moist, and I don't see any lesions there at all. The next thing I'm going to do is I'm going to listen to your lungs, okay? Now, in real life, I would be always on scope to skin. And for the sake of the movie, because I don't know where movies are going, we're not going to show all the points, but you can estimate where those would be. I'm going to keep her covered. And when I place my stethoscope down on you, I want you to deep breathe in and out, okay? I'm going to go side, underneath. Could you lift your left breast for me, please? Oh, give me some room here. Okay, there we go. That's good. Breathe in and out. All right. I'm going to come to the other side. Do not remove your stethoscope until the breath is finished. I'd have to wait for you. I'm going to do your sides right now. Could you sit up just a little? Thanks. Okay? In and out. Coming around. In and out. Remember, don't listen over bones. That was perfect. Not over the scapula. 2 more. You gonna pass out on me yet?
No.
That's great. Lay back again. Your breath sounds were clear through all fields by lat, anterior, posterior, and lateral. They were clear. I heard no adventitious sounds at all, okay? Now I'm gonna lower this just a tad bit, okay? Hold on. Okay. I'm gonna listen to your heart now, and I want you to just relax, breathe, just normally, okay, as I listen. I'm gonna listen in 5 places. I'm gonna palpate for there. There we go. I'm going to listen to the 4th and 5th spots, the tricuspid and mitral, from underneath. You don't have to say that, but it's just easier for me, okay? For most patients. Can you lift your left breast a little bit for me? Thank you. Great. I'm going to change and listen with my bell now on that. So just keep that breast up. Thank you. On the top again. That's great. I didn't hear any extra hard sounds or murmurs. The rhythm was regular. Everything sounded good there. So I'm gonna listen, inspect your abdomen now. I'm gonna lay the bed a little bit flatter this time. I started high. I'm coming down a little bit each time. Now you haven't done the abdomen yet. So you're gonna have to just kind of, you know, think about what I'm doing. I would pull the gown up and expose her abdomen, but I'm not gonna do that because of the video, okay? And then I would pull the sheets up on the bed to give her coverage. I'm gonna inspect. Did I leave that over there? It's eating up my time. I'm gonna inspect her abdomen. I'm gonna look for bulges. Abdomen is round. I don't see any bulges. I don't see any unusual pulsations. I'm going to auscultate, starting at the right lower quadrant. Oh, that's nice. Okay. Vowel sounds were active in all 4 quadrants. What I'm going to do now is percuss. We'll teach you all this next week. Okay. And then I meant to ask you something. Do you have any abdominal pain? I hope you don't, because I just percussed. Was it? I want you to flex your knees just a little bit, okay? And now I'm going to palpate. Where did you have the little tenderness?
Just right over.
Okay, well, I'm going to do that part last then, but I'm going to start at the right lower quadrant. Just gently palpate right here. Is that still tender? Okay, well, that's good then. So I heard the bowel sounds. I didn't detect any tenderness or distension. Could I get you to sit up on the side of the bed for me? This is about the time in the OSCE that if I wanted to look at the timer, I would look at the timer, because you can decide how much time you have left. Your skin tone is a light tan, some scattered freckles, and touch your face. Warm, 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 warm. I don't see any unusual colorations or anything like that. You seem to be warm bilateral as well. Your radial pulses are 2+ out of 3+. I'm going to look at your cap refill. Cap refill is less than 2 seconds times 10. Would you extend your arms out, please? Bring them in, out, over, And I want you to push against me and pull against me. So range of motion, full range of motion by lat. And muscle strength 5 out of 5 by lat. I see that your legs are also evenly colored, same light tan with a few scattered freckles. I'm gonna feel your, can you push against me just a little bit? Not much, just a teensy tiny bit. So I'm gonna, if you can't feel the pedal pulses, don't lie to us, just tell us, okay? But depending upon your time, you can do that. I really couldn't feel that one. I believe that you are, but I would take more time to do that, or look at the posterior tibial pulses to try to get that, depending upon my time. Would you stretch your legs all the way out for me? Fold them back underneath the table, and then fold them out and push against me. All right, and back. So I've got full range of motion by lat, and muscle strength 5 out of 5 by lat. All right. No edema by lat, and I'm going to do calf refill. Calf refill times less than 2 seconds times 10. And I'm going to help her back to bed, and I think that's it. That's my time.
No.